Sure, health interventions in men is particularly important, especially at the part, and that is part of the reasons why we started up. So in 2008 already, we started with our after-hour clinic. I think the next prevention avenue that we do at Impart, and it's not just for men, it's for everybody, is vaccines. Because vaccine, it was in the dark times of the HIV pandemic, just growing up. And I realized that I knew really very little about HIV in 1998. As one of my patients then was
wanting a lot from us. Sometimes if we go to our local community clinic, which I won't be mentioning, but if we go to those clinics, a lot will be wanted. Greetings, it's another Monday meeting, it's another show for the World Talk podcast, and I'm never alone. As you all know, I'm never alone. And today I'm with one of the most people we've seen or recognized as a hero of our township. Not only not only a hero, but a person who has helped our community in many different ways. Uh, there's a lot of people who can agree with what I've been saying. Uh, we do not know, or before the establishment of Beaport, especially, there was a lack of certain health things. So, due to the formation of Beaport, we've discovered a lot. We've studied a lot. I know the word study is one word that is like constantly used at Beaport. So today I'm with the founder of Beaport. Uh, Ma'am, welcome to the podcast. It's such an honor to be having you today. It's such an honor to be interviewing you today. And I would just like to let the people know who this in Xhosa we would say Ikawekazi, who this Ikawekazi is. So I would allow Doc to just introduce herself to the people, telling the people who she really is and where she really started from. Just so that the people may know who Doctor is.
hello, Sam. It's Sam, am I right?
Yeah, yeah.
Yes, yeah. Sam, it's an honor to be here today. I've seen you guys grow your own little business and your platform over the years, and it's really nice to see the new initiative that you are doing. So well done on that. Yeah. I am Lisa Hellstrom Low. I am a family physician. I have been doing work in communities forever since I know. And I'm also a mother of twin girls, and I have a husband who's a lawyer, and he works really hard and long hours. And yeah, I suppose because of that, I also don't shy away from work, and I have a lot of interests that I pursue as well. I like nature, I love gardening, I enjoy just walking in different paths. I love traveling, I love to identify and see new things. But above all, I like to see the community grow, and I like to see how young people evolve and become proud citizens and really develop their own capacities. That to me is a fantastic thing. Yes.
Thank you very much, Doc. Uh, as you've also mentioned that you spend your time in the community. Uh, would you first of all, before I ask the question I want to ask, would you tell me exactly when you started uh, working with the community, working with healthcare in the community and all that? Would you exactly tell me when was that, so I can ask you one question that I think will be an interesting question and
Yes, I think let's just focus on the Paarl surroundings, Stellenbosch Paarl communities. I did my house job at the Livingston Hospital, which is pretty much in the lesser privileged part of Gebergod, which is it was PE then. I'm still struggling with that word. In any case, but moving to Paarl in 1997, um, I did some. I had small children, so I did some work with as a volunteer for the Stellenbosch Hospice, and I worked also in a practice for, especially looking at a well woman clinic to empower women to be the best they can be. Um, but through my work at the hospices, and I worked at both the Stellenbosch and the Drakenstein Hospice, and then also helped out in Franschhoek Hospice at times. Um, it was in the dark times of the HIV pandemic, just growing up. And I realized that I knew really very little about HIV in 1998, as one of my patients then was referred for an insurance assessment, and she was diagnosed with HIV. So I made sure that I trained myself up. At that time, it was not well known, the
That's
illness.
that's 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 where I was like going exactly.
Mm,
I wanted us to have like the picture of starting being involved in the community in that time. In that time, as you've also mentioned that in the dark times of the HIV pandemic, and also in just how do you call it? Is it post or is it after just that apartheid pandemic? So I just wanted us to highlight that in that times you were able to come up and say, okay, now I'm gonna be involved and I'll be helping out in this and this, and that's one thing I wanted us to really appreciate. There's really less people who would do that, and it's really something that we should appreciate, not only as individuals but as a community. And I just so hope that the Royal Talk podcast will be appreciating uh, this heroine. Just uh, just take I want you all to have a picture of everything, of Doctor starting her career in that dark times, and it's something huge. It's something huge that I individually really appreciate and hope that the community also appreciates. So on founding Beapot, what inspired you to found Beapot exactly?
well, at that time, myself and a couple of my colleague doctors were working and volunteering at the HIV um, clinic in Paarl East. That was a centralized place where you could get your ARVs. And before ARVs became available in 2004, we literally just treated people to keep them alive. And because we knew ARVs were coming, there was a lot of pressure from activists and like minded people to move it forward into the political agenda. So we just wanted to keep these really sick individuals going. And in 2004, the ARV started, and we all know how it started. But then in 2006, we had the opportunity to write a proposal looking at ways that women could protect themselves. Because what we were seeing at that time was that the women were undiagnosed. They only realized that they were HIV positive when they either became very ill or when they had their babies. Because the men were not testing and the men were not sharing their results if they knew their status with their partners. So we had the opportunity to write a proposal for the IPM group in terms of microbicide research for preventing women with HIV. And that proposal was accepted, and then we had the opportunity to develop the center across the road to become an IPM site, and we looked at microbicides. Um, Unfortunately, the study was not successful, but it gave us the initial opportunity around 5 years to learn research and to engage with the community and to really build a trust relationship to start our platform of ongoing research at that time.
And it is really something I also know of. Maybe probably I wasn't even born at that time, but the fact that I've seen two stories of young ladies not knowing that they were diagnosed with this HIV pandemic or this HIV disease, but only finding out that they positive when they like really sick. So I also now need the people to imagine that it was something that was needed. Bee pod being farming was something that was needed because maybe if it wasn't, maybe we were gonna have more people dying out of HIV. People not knowing the status exactly, but due to the fact that doctor has okay. Now I have a lot of questions. That I'm really not a health person, but B part or doctor herself is something that inspires people like us, especially us young people. We need to set health interventions at this young age. We need to know certain things of our health and of our bodies. So having a clinic like being part in our communities, and not even wanting a lot from us. Sometimes if we go to our local community clinics, which I won't be mentioning any names, but if we go to those clinics, a lot will be wanted. Uh, to get help, even we have to be waiting a lot. We have to be waking up early to get aid. So having be part in our community is something huge. It helps us a lot because I also know how rapid it helps a person. And if you are part of any studies, I know that Peapod is always willing to help you in any other thing, even besides what you went there for. It helps you in anything else that comes to your health when it comes to your health. So it's something that's really positively impacting our community. My question: How do you how important is health interventions in men, especially because sometimes men think they are the one that are okay, we always sharp, we don't need to know what's happening with our bodies and all that. So how important is it for a male to know anything happening in his body?
Sure, health interventions in men is particularly important, especially at VPART, and that is part of the reasons why we started up. So in 2008 already, we started with our after-hour clinic, and it was actually aimed at men and testing men for HIV specifically. And then along with HIV came TB, and along with TB, STIs and other health interventions like blood pressure recordings and risk for cardiac disease. And the reason why we focused on that is that, like you say, men don't want to go to the community clinics. It's a place for women mostly, where you go for your baby checks and your bring the babies, and women have many more health opportunities to test while they in their productive reproductive years, whereas men do not access that, and that's the problem. And I think what I saw in the early 2000s was we're really very clever, smart young men actually were dying with HIV unnecessarily because they never tested and they didn't bring themselves forward. to start on treatment, and it's still ongoing today. It's less so now because there is much better places and access for testing and treatment. However, it's so important that men know their bodies. Health is the biggest benefit you will ever have. And it's only when you become sick that you realize that. And that's usually when it's too late. We want to prevent things, we want to catch them early so that you get the best benefit. In HIV, for instance, if you wait too late, then your immune system is buggered. And if it is like that, you can't really recover ever enough. You can improve, but you will never recover your immune system completely. So you're always on the sort of last end of the stick in terms of health. So yeah, I think that B part really opens their arms for men, and don't ask questions. Not why you're there, what you want. We do that.
And on that point, what preventions does BPOD have or set in place for men to not being in a situation where they are too late, probably.
Yes, I think the first thing would be know your status. I mean, it's an old slogan, but it's still true. The second one is to follow through and make sure that you end up on treatment and that you go regularly for that follow up and checkups. Um, at BPART, yes, if you do participate in a study on antiretrovirals, then that certainly is an opportunity. I think the next prevention avenue that we do at BPART, and it's not just for men, it's for everybody, is vaccines. Because vaccines, if we can develop that, we can prevent, for instance, TB. We're working really hard on a TB vaccine research now. The HIV vaccine research has always sort of left us in the blind. We still don't have one. Um, but also, in terms of other infectious diseases, we went through the COVID pandemic. We now know that vaccines do work. Um, there's influenza vaccines, there's an RSV vaccines that we've tested, the outcomes of which is not quite clear yet, but we're moving in the right direction. Infectious diseases is especially this community's biggest threat.
And that's really really true. Uh, and as I've said at the beginning, that due to the founding of BPOD, many lives are saved. Not only lives are saved, but people are able to prevent disasters. People are able to prevent disasters. And for a person to be part of that, or for a person to prevent with BPOD, how does a person connect with BPOD, or how do I, if I now want to prevent a lot of diseases, or I wanna have, or I wanna know what's happening in my body, especially. How do I'll be lost if I just enter it. Or what do how do I basically connect, or how do I talk to a person to like understand and help me in that certain moment?
Sure. To be able to prevent illness, you need to know what is happening and you need to know your body. So we are most people are well aware of the after hour clinic, which happens on a Tuesday from 2 till 6. You can also register for a study at BPART. You can just come and give your name forward, and then there will be a couple of health checks that are being done. Mostly, we want to do either vaccine work on fairly healthy people, or there are very specific illnesses that the research focuses on, and obviously then you need participants who already live with those diagnoses, such as asthma or high blood pressure, etc. So in terms of that, yeah, use your opportunity through the after hour clinic. We also now have a pop-up in the Dal Yusufat area, which has an after hour clinic on a Wednesday. And there are some people, especially men, who prefer not to test in their own community because they're scared of people seeing them go there. So there's actually now another opportunity to access at the Dal Josephat area. Yeah.
And so there are many different people accepted, as you've now recently mentioned. Everyone is welcome and everyone is accepted. And there's ways to probably people love being private when it comes to their health. So now, as you've now said, there are many ways that people can be a bit more private. So we can probably say that B part is a friend we can trust on, especially when it comes to our health, because we sometimes also uh, need that person or that one person to talk about when it comes to our health. We need that one person who will update that, okay, I'm now good. I'm not feeling well. So the way I see Peapod, I see Peapod as a friend that is there for the community. Any type of person, any type of person. There's no restrictions, doctor. There's no restrictions, as I've also seen. There's no restrictions if you are a certain person. You can't come to people. If you that, you can't come to people. So everyone is welcome. Everyone is welcome. So to the people out there, to the people out there, who really wants to come, but a bit afraid or uh probably scared that B part won't be that friendly. Is there any way? Because I surely know that there will be people watching, a lot of people, and I want to know if there's any way that you can ease them to come join B part, because I want them to come after watching this episode.
Yes, if people want to come, they only need to step through the gates. At the moment, we're still renovating, so our side entrance is open, but soon we will have our actual access in front. Um, it's really important that you bring all your documentation with you, like an ID and specific health documents from the past, maybe a clinic card or something that you've had, or medication that you're still currently taking. That'll help us a lot to place you. Remember that everything is confidential at BPART. We really go to a lot of trouble to ensure that all documentation is not shared with people who should not be entrusted with it. And also, the staff at BPOT are always friendly. If they're not friendly, they must deal with me, please. But I think that a smile goes a long way in helping people to feel at ease. Yes, sometimes we're busier than other days. So if you're really in a hurry, maybe make an appointment and come back. And then on, as I said, on a Tuesday in at BPART, and on a Wednesday we specifically open up and provide more staff to assist you fast and make it in and out as quick as possible to have your tests done. Yeah, so that's the starting point.
And to the youth out there, uh, I just want to know how Bpart is making or opening up opportunities to the youth, especially in being part of this project. If Doctor could just explain or tell us how the youth can be part of the project, maybe not as a person who's coming to check up or do something, but be part of it.
Yes, the youth has a very important place at BPART. As you know, we run many adolescent studies, but we also have a youth program. And that started many years ago with a gentleman like yourselves, Lazola, who was the guy who approached us and said, "So, what are you doing for the youth?" And I think over the years we've developed steadily a program which really embraces all that we want to see in the youth of Mokweni and see them grow, see them develop their talents and have access for the best going forward. It's not an overnight thing. And I think that belonging to the youth program, the youth group, the YYG, is a first step towards making sure that you take the responsibility for yourself to empower and improve your own capabilities and your ability to one day get that job that you dream of and to be able to really be you. So
So,
welcome.
so if we now want to join, or if I now want to join the youth program, how do I join, or how do I get to be part of it?
So yes, if you want to join, there are certain formalities that you have to do. Unfortunately, we cannot be everything for everybody. It's just not possible. We're not the government. They're supposed to be doing a lot of these things, and we take baby steps. So at this stage, we welcome everybody between the age of 10 and matric. So whatever age you are in matric. Um, we do not run a program for post school youth yet. It's a very tricky pathway, and we still sort of looking at it and how we best can also link with other organizations like LEAP and REAP and Year Beyond to ensure that there's capacity for the older youth as well. But for the younger people, you just need to come and register with SIPO and with Malaysia. And at the moment, they're running a catch up session. And then the program actually starts in January of every year, where there's a sort of orientation program for newcomers so that those who are already in the program don't feel bored that they have to listen to the same things over and over because they form a community and become friends, obviously, as well. But the youth program, there's a lot of fun, but there's also a lot of development happening. So there's also discipline. Being late for a meeting is really not on because then you waste the others' time and you make it hard for them, and then everything will go to waste. So there are some responsibilities that you as a
And
potential
and
partner does.
to just wrap it up, Doctor, uh, is the it's just out there, and now I want people. I hope people have now heard at least, uh, and now realize that Peapod is really making an impact in our community, and not just any impact, but a positive impact. And we need to applaud that, not only applaud that, but we need to recognize that. And there's a say that you should give people their flowers while they're still alive. And if I was healthy enough, I was gonna buy Dr. Flowers for it to be literal and physical. But we really appreciate what Doctor has been doing in our community, and we really appreciate the project has grown big. I see. It is now something huge, and that's how you've impacted the lives of people hugely in a huge way. And I really, really, really wanna applaud that, and I wanna thank Doctor. Maybe there are people out there who've always been wondering who's the founder and who's behind this and all that, but who have never knew who it is, or have never gotten the chance to meet you. Now, I who have met you now, want to say thank you. Thank you for the lives that you've saved. Thank you for the diseases that you've prevented out there. Thank you for the opportunities that you've opened up for the youth. Just before I wrap up, the people or sponsors who has made it possible for people to be in this certain situation. Uh, are they sponsors? And if they're sponsors, is it possible that you can mention the sponsors?
Yeah, you say there's an African saying that says a bundle cannot be fastened with one hand. So one person cannot be an island and be the one and almost. It's taking a community to help a community, and it also takes a whole team to work together. Um, we have sponsors for the different research programs. They shy away from being in the forefront. They don't want always the names to be mentioned, but you know that we had the Bill and Melinda Gates Foundation representatives visiting us recently. We work with them. We work with other pharmaceutical companies. And then we have individual sponsors. We have people who really want to see change, and they give of themselves and of what they have to support the goals of the not-for-profit. We are agents of change, and through helping this community, we can actually be the change that South Africa needs, especially for our youth.
And that's really it. If there's, I really hope that this episode has been educational, or has helped a person who's always wanted to know about Peapod. Uh, I really, really, really appreciate you making the time and being here with us today. I know you're really a busy person, and I really, really thank the fact that you are here. And oh, before, if a person wants to go check out Peapod, where can we find Peapod?
You find us on our website. You just type in Be Part, and you will find the website. And there's also a Facebook page linked to that.
Okay.
So yeah, you'll see us there.
So if there's anyone uh, wanting to prevent a lot, wanting to know about their bodies and all that, just go search Peapod. You'll find it there. Doctor, thank you very much. And from my side, Ilham Samkelo, and from the Royal Media House, and from the whole crew, thank you very much. Uh, for me, Ilham Samkelo, thank you very much.